Hello, I'm Dr. Clint Sexton with Naperville Integrated Wellness, and today we're going to talk about the question, the topic, are functional medicine doctors real doctors? So it's kind of an interesting question. I'm not sure really what makes someone a real doctor or not. I believe that what a lot of people are trying to find out is are functional medicine doctors medical doctors, or do real doctors only prescribe medication, or do they only perform surgery? Or, I'm not really sure what makes someone a real doctor. That we can kind of talk about the difference between traditional medicine or doctors that maybe we're used to seeing and functional medicine doctors. So the basic model of real doctors, the standard model would be you'd go in, you'd consult with a doctor, they do an exam, run a test, provide you with a diagnosis, and then you typically end up getting a prescription for a medication at that point to manage the issue that was identified. So that's our model of healthcare. That's what most people are going through. So then are functional medicine doctors real doctors? Then no, we're not. if that's the model or the criteria we're going by. So what's different with functional medicine is that we're trying to work with the body. We're trying to find out why you have the issue you have. So let's say that you have an issue of chronic migraines, for example. And so you would go to the doctor, or you go to a primary care, or go to a neurologist and do an exam and maybe some other studies. Then ultimately you'd be given a medication to help manage your migraines. So that's how that's handled. Now in functional medicine, if someone comes in, they have migraines, we want to look at that and go, okay, so what's a migraine? What causes, what's the underlying issue here? So we're talking about changes in blood flow, or the blood vessels that are affecting the area in and around the head. And then so what causes those alterations? What could cause those blood vessels to change? So they don't just change on their own, something's triggering it. So maybe we're looking at chemicals that the body's making. Maybe we're looking at a neurotransmitter issue such as serotonin. So the medications work with influencing serotonin. Or maybe it's a different kind of chemical reaction, like a histamine response. And so that's a chemical that's involved with the immune system, but also acts as a neurotransmitter, so it's also a nerve-related chemical. Or we're looking at other aspects of the diet, or maybe we find that, well, we have more migraines around a menstrual cycle, or something hormonal based. We say, okay, so now how would the hormones influence this? And is there something, do we need to balance hormones, detoxify hormones, or are hormones just kind of the final straw? Maybe you have a change in hormones, and you have a dropping of hormone or increase in hormone, and that influences another system that influences the chemistry that's affecting these blood vessels. So the point is, we look at things differently. We don't just want to arrive at a diagnosis. I have migraines, or I have Hashimoto's disease, or I have IBS, or I have chronic fatigue syndrome. We don't end there. That's just the beginning. The diagnosis is kind of the end, okay, in real healthcare or real medicine, or what real doctors do. Here's your problem. Here's your prescription for this. You're usually not given much else to work with, okay? That's where we begin. Oh, we have a migraine. We have this condition. Okay, what systems are going to cause that? So we're kind of working it backwards at that point. We say, okay, this is the problem, but what's contributing to that problem? And that's where we do different types of testing and ask different kinds of questions. And so it's a lot more work doing functional medicine. It's much more time consuming, labor intensive. It's much more involved because we're trying to understand the problem, okay, more accurately, getting down to these fundamental issues, the root cause or causes that are resulting in this dysfunction. Because if you have a health problem, you have some level of dysfunction or dis-ease or imbalance. That something's not right. We're there to help restore the balance, not just overwhelm, mask, or get rid of the problem. It's just a different approach. It's not that we're right or we're wrong. That's just what we do in functional medicine, and that's our approach. And so if you look at, well, what should a doctor do? Okay, so the questions are, so are functional medicine doctors real doctors? If you're looking to come in 10 minutes, give you a diagnosis, and write your prescription, then no, we're not. We're not real doctors. There's all kinds of doctors and health professionals that are practicing functional medicine, but what they have to be able to do and what they have to be able to understand is how to work a problem backwards. Understand what systems and what imbalances could result in this problem you're having, instead of, well, what's the fastest way we can just kind of make this easier to live with, or to make it so you don't notice it, etc. So Hopefully that kind of answers the question for people that are wondering, what's a real doctor? Are functional medicine doctors real doctors? What meets that criteria? So I don't think people would be looking at functional medicine or looking or investigating or spending any of their time trying to find out about functional medicine if they were happy with their real doctors, because they wouldn't have an issue. You don't go trying to solve a problem if you don't have a problem to solve. So if people are looking, that means obviously the care or treatment or the approach that they've received and experienced so far hasn't handled the issue for them or hasn't met it to the standard they're looking for. So again, it's not a matter of, what's a real doctor? The question is, you're working with a health professional who understands disease, understands condition, and understands how to work it back and what imbalances can result in that issue you have. So hopefully that answers the question for those of you that had that question kind of floating around. If you want some more information, some more details on this, check out the blog. Thank you.